So I'm here with my patient who had a total hip replacement, and she had a posterior approach. So my lovely patient, did the doctor explain to you, or do you remember what we call the hip precautions, the motions you're not supposed to do with your hip? No, say no.
No.
No, she doesn't remember. It's that anesthesia. Okay, so where they did the incision is right back here. And basically, we don't want the top of your leg bone, your hip, to push backward into that tissue, okay? So what you cannot do is you can't raise this leg up to 90 degrees, okay? So easy way to remember that is, I'm gonna show you on this leg, okay? As long as your knee is below your hip bone right here, you're good, okay? So if your knee came up past your hip bone, that could dislocate your hip, and we don't want that to happen, okay? So when you're sitting up, if you lean back a little bit, or just make sure your knee is not as high as your hip, as long as your knee is down below your hip, you're good, okay? The other thing you can't do is you can't cross your leg over your other leg, okay? And then you shouldn't turn your toes facing in, okay? Toes just keep them pointed straight out in front of you. Okay, can you repeat those back to me?
Don't bring my knee up past my hip.
Perfect.
Don't cross my legs.
Good.
And keep my toes straight.
Perfect, you got it. Okay, so when we're getting out of bed, we have to keep that hip protected. Okay, so I'm gonna show you, we're gonna pretend that this is the leg, okay? Or actually, you know what, we'll go this way. We'll pretend this is the leg that had surgery. Okay, so in bed, an easy way to remember not to cross your legs or not to let your leg roll in is we're gonna keep a pillow between your two legs when you're laying down.
Okay.
That way if you fall asleep, you don't accidentally move it in your sleep, okay? Now, when we get up, this is nice too. I'm gonna put an extra one right here, because what we're gonna do is roll to our side, and this is gonna keep this leg from falling in towards your other leg. Okay? So can you scoot that way just a little bit? Oh, you are moving great for just having surgery. Okay, now we're gonna roll this way, and I'm gonna help support this leg. Excellent, you can let it relax on those pillows, but see now this leg didn't fall in. Okay, so that's gonna protect it. And then from here, you can push up, and I've got your leg, I've got it, and just let it, and lean back for me. Good, remember, because you want that knee to be below your hip. Okay?
Got it.
Perfect. Okay, now my patient's perfectly safe. Of course she is, because I would never leave her if she wasn't safe. Okay, and we're gonna say you are partial weight bearing. Okay, jump up like you know what you're doing. Oh, that was nice. Okay, now remember, let's walk out here just so we have a little bit of room. Partial weight bearing, and she already knows all that because we taught her. Excellent. Okay, if we were gonna turn around to go back to your bed, if you turn towards me, look what happens to this leg.
Yeah.
Okay, oh wait, it was this leg, wasn't it?
Yeah.
Okay.
So I gotta keep it on.
So if you turned this way, you see how that leg turns in? So if this is the operative leg, I'm gonna instruct you, always turn this way. Always turn towards your good leg. Okay, and that way it never turns in. Okay, perfect. Come back down here. And now you're gonna be a different patient. Okay, now you had an anterior approach surgery. So they went in right here. Okay, or we'll stay on the same leg. They went in right there. So now we don't want your bone to push forward. And the only time that would happen would be if you extended your hip or if you externally rotated. So now those are the two things you can't do. Okay, which makes it real easy to sit up. Okay, so to sit up, we're just gonna sit up. Okay, you can roll to your side. This leg can fall in if you want, or we can just work our way up and around. But you're really not in any danger as long as you don't do that. Okay, so why don't we roll to the side, and I'm gonna help you with this leg. Excellent, good, and come on up. Okay, it could go all the way up here. No danger at all, okay? No worries at all. Okay, and we jump up, we'll say you're partial weight bearing again, and let's come out here. Okay, good. Now, we're tired, we wanna go back to bed. Now before I taught you to turn this way. What happens if you turn this way?
I'm gonna externally rotate.
You externally rotate. So now you're gonna turn towards your operative leg. Perfect. Okay, just a couple more things. Do we have a chair? I'm gonna grab a chair real quick. If this was a normal chair in your hospital room, go ahead and stand up. Don't worry about the walker.
Okay.
Okay, just sit down in that chair for me. Good. And go ahead and stand up and stop right there. Just see how much flexion you have in your hips. Okay, if you had had a hip replacement, a posterior hip replacement, remember you can't bring the knee up this high, go ahead and stand up. So what we'll do is we will build up the chair surface, and before you sit down, I want you to slide that leg out, reach for the arms, and lower yourself. It's kind of like a pregnant lady sitting down.
I can relate.
Okay. And then when you go to get up, you're gonna scoot to the edge, kick that leg out, and stand up. There you go. Okay, perfect.
Got it.
Thank you.